Okay, I'm going to have some choicey language here. For those of you who have seen my clips before, you know my language is not necessarily colorful, but this clip will be. So I'm going to apologize in advance so that if some choice words offend you, you will know beforehand. But I'm going to let them rip on this one. What I want to talk about now is the health care situation going on now. The Republicans are geared to vote on their plan on tomorrow. We'll see how that goes. But we need to talk about a couple things. Now, I know that the Affordable Care Act, also known as, or better known as ObamaCare, came into existence without a whole lot of popularity. People been hating it. I've been hearing things like, don't want the government in my health care, big entitlement program, government in our lives, and so on and so forth. Republicans beating the drum with that. Tea Party came into existence on the heel of some of this. Nobody wanted the government in healthcare. Now, a couple things. Healthcare costs have been going up like crazy forever. I mean, come on, people. We know this. We also know that people get sick. We know people get in accidents. People have to go to the fucking hospital. We understand this, right? So why do we act all of a sudden that everything was honky-dory and then Barack Obama and the Democrats came in and messed up this perfect system? The system was not perfect, okay? Understand that. So when you're talking about health care, something had to be done. Democrats came in office, Barack Obama came in office and said, let's try to tackle this thing. Republicans didn't want anything to do with it. Okay? Now, we can bury our heads in the sand all we want to and act like healthcare has been great all our lives, but it hadn't been. People didn't want to pay, didn't like the individual mandates. Nobody should force them to pay insurance. That's what they said. Yet, if something happened to them, one, President Ronald Reagan already put into law that anybody going to emergency room, the hospitals could not turn them away. All right? So if you go to an emergency room and you don't have money and you don't have insurance, who the fuck you think paying for that? You think the hospital will just eating the cost? No, the hospital is passing it on to the consumer. So we were paying for your ass anyway. So somebody comes in with a system, say, you know what? Let's see if we can't make everybody pay up front. So then we get the Affordable Care Act with the individual mandate. All right? Then you say it's an entitlement program. Well, somebody please explain to me, if there's an individual mandate, how the fuck is it an entitlement to? If I'm going to make you pay for insurance, how am I giving you something? All right? So you have people arguing on two sides of the damn same coin. It makes no sense. All right? So they passed a bill. They had to do reconciliation, all that little stuff. And Republicans say, oh, you passed it without any bipartisan support. You snuck in. Even though the whole time, please come talk to us. Come on, let's sit down. You know, you like individual mandate, because individual mandate was a Republican idea in the first place, right? So you put in the individual mandate, because remember now, Democrats would have wanted it to be a straight up entitlement. So they put the individual mandate in place to appease Republicans, and then they were talking shit about that. So you pass it, comes into law, makes law. And they kept, when they first put it in, they kept phasing it. We're going to do such and such in 29, then we're going to do something in 10, 11, till finally about 5 years or 4 years down the road, it's going to be fully implemented. Republicans still want to kick the damn can down the road. So it gets in place. Everybody howling. Don't like the Affordable Care. Don't like that. And then people saying, and about President Obama said, if you like your doctor, you keep your doctor and all that, so on and so forth. And then people come to find out that wasn't true. And so, oh, you lied, you lied, you lied. He didn't lie, he misspoke. And there's a difference. First of all, anybody who has ever had insurance with an employer for any number of years know good and damn well it was a crapshoot if you're going to be able to keep your damn policy from year to year. Companies were changing policy so fast, you know, your head was spinning. Okay? You could have Partners 1 year, Blue Cross Blue Shield the next, United Healthcare in year 3. And if your doctor was not in that new plans network, guess what? You had to choose another fucking doctor. You have a choice. And that's why I wish that somebody would have told the president that back in 2009, and he would have never have made that statement. He would never have made a statement giving people something they didn't already have. Anybody knows you couldn't keep your same doctor if the company changed network all the time. It wasn't 100% sure. So you didn't lose anything when the Affordable Care Act came along and people found out that. I have had employee insurance for about my whole working life. First time I got an opportunity to get it was in 1992. I was 24 years old. I was working for Sears in their catalog department. Since defunct, closed down, went out of business. A lot of people lost their jobs, been there a whole lot of time, another post. Anyway, the first time I was offered insurance, health insurance, I turned it down. I looked at my check. I was making about $190 a week. Insurance was gonna cost me about $5 to $10. I said, nah, that's too much money coming out my check. I turned it down. I rejected it. Didn't want it. Yeah, I'm 24 years old, healthy. Never went to the doctor. I felt okay. That was gonna take away that part of my bill money. Okay, so I don't take it, and I came off okay. Now I did get in a car accident, like 6 months after I turned it down. Came out of the accident okay. Didn't go to the hospital to get checked out because I didn't have insurance, so I ain't want the hassle. Right? Something could have been wrong with me. I was lucky, fortunate, nothing was. But I was young. That's the young people. Young people, when given the opportunity of having some money for beer and money for insurance, most young 24-year-old knuckleheads is going to choose the money for the beer. I was a knucklehead. That's what happened. If that car accident would have been a little more serious, then people would have been on the hook for my old knucklehead ass. So individual mandate for young people makes fucking sense. Okay. All right, so now we come up to this year. Donald Trump, first of all, promised that he was going to give the people something fantastic. Everybody's going to have insurance. Oh, man, it's going to be lovely, lovely, lovely. You're going to see, you're going to see, you're going to see. This bill that Republicans got on the table now, Donald Trump hadn't even looked at. And he's touting all the great stuff in it. And I know he hadn't looked at it because ain't no hell in the world, nowhere in the world that Donald Trump can be touting this plan as this marvelous plan that he was talking about on the campaign trail. First of all, this plan wants to shrink Medicaid, right? And instead of giving the states Medicaid money, the plan says, you know what? We're going to take that money we used to give, we're going to block it up. And when we say block grant, that means we're going to take all the money we give you, been giving you, we're going to put it in a block. You ain't got necessary use for Medicaid, use it for whatever the hell you want to use it for. Okay? So we're going to give it to the states. Let them decide. So you give the states a block of money. And the money's going to be less than what they've been getting before. And you ain't going to get to the states. So in a roundabout way, you're kicking people off the insurance rolls. Yes, you lower the money you're giving out because you can lower the deficit that way, not a big amount, but you will lower the deficit because if you're giving the states less money, that's less money coming out of the budget for the federal government. So over the long run, deficit will decrease because it should, but more people are going to be kicked out the road. Now, that's deficit according to your books. In the backwards way, what's going to happen is the rates are going to go up for other people because now there are going to be more people going into the hospitals or emergency rooms or being treated that don't have insurance. And so the hospitals, once again, are going to have to spread that cost around, so premiums are going to get jacked up. You know, that's just simple math, block grants. Trump got to see that. Got to see that in that bill, but they don't care. He hadn't looked at his bill. So whatever plan Trump said he had, he don't have. That's another thing. So now the Republicans coming out with that. That's block grants. Then Paul Ryan come out and say, you know what? Because people shouldn't have to pay for other people's insurance. You got the sick people paying for the healthy people. What the fuck is that, man? Ryan, Paul, people, listen. What Ryan is talking about is the very essence of insurance. Insurance is all about spreading the risk. So that when a catastrophe happens or disaster happens, then that one person won't be financially ruined. And that same protection is afforded for everybody that's in that insurance pool. So you don't get kicked off because you got cancer and get kicked off into a corner like Ryan is talking about. No, when you get cancer, insurance got their actuary tables. They know exactly how many people should get cancer. So if everybody participates in the program, the insurance records will be spread out so they know exactly how much money they should be charging people for premium. So when that one accident happens, or that tragedy, that cancer, that disease, whatever happens, it's already factored in the table, then that person gets taken care of. You start kicking people off when they get sick, talking about some reinsurance pool, right? People over here might get paid less, but what's going to happen to these people over here that got the reinsurance pool? That same pool that is counting on that money coming from the government that they're going to stop doing, right? Now, who you think gonna ultimately end up paying for those sick people anyway? That's right. Our dumb ass, if we believe this plan. Okay? The plan is bullshit. Point blank. Trump hadn't looked at it because it doesn't even reconcile with the statements he made. Obamacare was not perfect, right? But it's a better starting point than this this American healthcare bill that they got coming up right now. For the life of me, I don't understand why you don't just start with the Obamacare plan and just do the fixes. If you cared about people having insurance. And if you don't start there, that means you don't give a fuck at all. And so, and I'm cool with that in this sense. If you're saying that the government should not ever have anything to do with insurance, and that's your straight up opinion, that's one thing. But don't shit on the table and call it and try to tell me it's shinola. So don't come with this American Healthcare Act talking about that's going to do all these wonderful things, because that's bullshit. Ryan knows it, Trump knows it. You can come out and say, we're going to repeal Obamacare and we're going to let the healthcare market do what it do. That's one thing. But to come in and say that this plan that you got here is better, it's crazy.